Adolescent psychiatric nursing. Today's objectives are to identify developmental tasks of adolescents, discuss the major areas of assessment, identify and examine maladaptive responses, identify nursing interventions, and evaluate care provided to adolescents. Adolescents are at a unique time of transition, and the role of the psychiatric nurse moves more towards that care of the adolescents, and also as they move towards adulthood. These are because these are unique times, we're helping them with social, emotional, and physical aspects, and helping them adjust to family, schools, and peers. Many of the health disorders that begin in adolescence go undiagnosed or untreated and move on with them into adulthood and then become chronic illnesses. When we look at developmental tasks between that age of 11 and 20 years old, there's a shift in growth and learning. These are complex changes between biological, social, and emotional development. They don't necessarily lead to psychological conflicts. However, major events can occur and attempts can be made to deal with them and improve or move the behavior of the adolescent. During this adolescent time, there are many things that we want them to achieve, like mature relationships with members of their own age. We want them to understand what their social role is, accept their physical build. We want them to use their body more effectively. We want them to have emotional independence and from especially their parents and older adults. But then we also want them to prepare for marriage and have a family life. After that, it's important for them to have a good career. We want them to prepare for that career. And then we want them to acquire a set of values and ethical systems that can guide not only their behavior, but guide them in developing their ideology. Some assessment questions that we want to ask or use when we're talking with our adolescents are questions such as what concerns them about the adolescents, and this is what when we're talking to the family. And then we want to ask them, when did they recognize that there were problems that began to start? What changes did they notice? Have problems occurred at school and at home? What makes behavior better or worse? How have these problems affected relationships with siblings, peers, and teachers? And has school performance changed? And this gives us great insight into their development. When we think about outcomes, we want to be able to identify adolescents who are at high risk for problems, looking at whether or not their behavior is adaptive or maladaptive as it relates to their body image, their identity, their independence, their social role, and their sexual health, which is their sexual behavior, which is what we're going to talk about. So with their body image, you got to remember that adolescents often imitate behavior to keep within this expected normal range of conduct that's supposed to happen at their age. They're different from the rest of the group, and when they can be, when it's noticeable, it increases their anxiety. Growth is uneven and sudden, and they begin to compare their primary and secondary characteristics with their peers, and sometimes if it's maladaptive, it can turn into an eating disorder. With their identity, this is also in response to the physical changes that they're going to go through during puberty. Heightened periods of excitement and tension are going to be there, and they're going to attempt to cope and act like an adult, and fluctuate sometimes because they're still a child. It just depends on how they're adapting. Maladaptive responses, though, impede their growth and development. Nursing interventions will be about why they are responding the way they are and the harm that can result from it. Like talking to them about inappropriate sexual activities and how they lead to HIV and sexually transmitted diseases, and also teen pregnancy. When we think about mood disorders, it is really difficult describing mood states and emotional states amongst your adolescents. Teenagers do not complain, they just become moody and irritable. Reduced self-esteem and hopelessness impedes their ability to engage in problem solving. And the greatest risk especially comes from a family history, if there is one, of depression. Symptoms of depression within your adolescent looks like things like anxiety disorder. They may engage in substance use abuse. They may have a suicide attempt. Maybe they're not achieving the way they would like to in education. They're unemployed. They have early parenthood, frequent nonspecific physical complaints, or absence from school and poor school performance. They can have boredom, lethargy. They can have these outbursts and crying and moodiness. They can have irritability and anger. They can have a disinterest in their friends. They can have decreased interaction and communication, fears of death. They can have anhedonia, which is that inability to feel pleasure. And they can be sensitive to rejection and failure. So when we go to treat our adolescents, it has to start with first cognitive behavioral therapy. And then as we move into cognitive behavioral therapy, we move into things like medication and even Prozac. Bipolar symptoms include mood fluctuations and instability, poor impulse control, aggression with irritability and agitated behavior, and differs than that from an adult. Nursing interventions caring for a bipolar patient, a bipolar adolescent, is about making sure it's age appropriate, think about the level of development, calculating the risk and benefits of medication, making sure that we're carefully explaining it to them, educating the parents about the normal outbursts versus those extreme moodiness, and knowing how to navigate that. Not only because they are an adolescent, but also because of what may be accompanying or beginnings of mental illness. Our adolescents are at increased risk for suicide. Firearms are the most common suicide method. Depression, conduct disorder, bipolar, substance abuse are more common comorbidities that go along with suicide attempts. The completion rate is higher in individuals who may associate with themselves with being either gay, lesbian, or bisexual at youth. It is important to know that many times adolescents call out for help. We have to know when to recognize that and when to act on it. Or as nurses, we have to make sure that clear suicidal behavior is not kept confidential. It is a cry for help. If they ask you to keep a secret, they want you to tell somebody. And that's when you have to recognize that that's what you need to do. Self-injury is deliberately destroying their body tissue to change the way they feel by carving, scratching, burning, cutting, tattooing, or excessive body piercing or pulling at the skin. It distracts them from the real pain that's happening to them mentally. It's majority of the time they're released from having to verbalize what they're really feeling and how that emotional pain that they're feeling. Physical discomfort and low self-esteem, along with hiding of scars and bruises, are all the things that we take into consideration as a part of our assessment. What is your job? Your job is to help to identify and help them verbalize those feelings, using distraction techniques when destructive feelings arise, deep breathing, guided imagery, ice on the skin. Talk to someone. Let them know that they're available to talk to you. Conduct disorder is common amongst adolescents, and it's behavior that violates the rights of others and the norms. So they engage in fighting, cruelty and lying, truancy, aggression towards people and animals, bullying, threatening behavior, stealing, forced sexual acts, and they often have poor relationships with their parents. Amongst adolescents, homicide is the second leading cause of death between the ages of 10 and 19, and 82% of those deaths are by guns. These adolescents experience aggression or frustration, or they have a violent role model. However, if there is aggression, you can take that and you can help them to channel that constructively through a learned process involving them engaging in activities that bring about a change in that behavior and help them to actively engage in problem solving. Risk factors include weak bonds with others, inefficient parenting, exposure to violent acts at home or in the community. Again, substance use, 50% of deaths are ages 15 to 24. Alcohol is most commonly used or abused substance. Marijuana, although it's becoming legal, is also being commonly used, and cocaine is being abused as a stimulant. What do we have to do when we're working with adolescents? One, we need to have knowledge of their development. We need to have initial contact with them, have a one-on-one with the adolescents, align with not only their independency, but also instilling in them and helping them to make mature, responsible decisions, and advise parents to ask for advice, to be honest. Our roles end up being giving health education to parents, but also to the adolescents on the expected behavior, what they're going through, interpret what's going on with them, the underlying conflicts, and promote resilience. We have to prepare the parents, the teachers, and other community members to be able to be supportive of adolescents and encourage healthy, independent functioning. We have to support frustrated, angry, and confused parents. We have to encourage independence and lessen power struggles to reduce positive changes. And we have to guide the parent to set limits and provide structure in a way that encourages that independent functioning.